Hello, I am Professor Ibn Auf from the German Islamic University, the Faculty of Medicine and Health Sciences. I will continue my lectures on wound and complications of wound, that is wound and gangrene. This lecture will be on vascular ischemia and gangrene. And the objectives of this lecture is that by the end of this lecture, the student will be able to define embolus and thrombus and describe the causes and clinical features of DVT and treatment of deep venous thrombosis, describe the causes, clinical features of acute and chronic limb ischemia, and the treatment. First, I will start with the Virchow's triad. This is composed of three factors: causing thrombosis, reduce viscosity, velocity of the blood, and increase viscosity of the blood and endothelial surface injury. The reduced velocity of blood is because of obstruction, whether there is obstruction in the lumen of a blood vessel or in the wall or outside the wall, or in heart failure. All these will reduce the velocity of the blood, leading to stasis and thrombosis. Also, the increased viscosity, as in very high red blood cell count, as in polycythemia, and in white blood cell, very high white blood cell counts, as in leukemias, and very high platelet count, as in thrombocytosis. Also, diabetes, dehydration, and hyperlipidemia will increase the viscosity of the blood. So the viscosity will increase either due to increase in the blood elements or in the reduction of water or increase in the lipids and sugar of the blood. Also, the third factor is endothelial surface injury, and this occurs in either autoimmune diseases, in Berger's disease, or in trauma. Now, what is dry gangrene? The dry gangrene is desiccated, black, hard distal part of a limb due to cutoff of the blood supply. And the cutoff of the blood supply is due to either an embolus or thrombus or trauma or neglected tourniquet. Like here, the toes are becoming black and desiccated and hard. Now, the difference between embolus and thrombus. In color, arterial embolus is composed of platelets and fibrin, so it looks whitish, while venous thrombus is made up of red blood cells and fibrin, so it looks dark red. And stasis, the embolus usually moves with the circulation from one part of the circulation to another part of the circulation, and stops in the bifurcation of a smaller blood vessel, leading to cut off the blood supply distally, while the venous thrombosis is clotting of blood inside the vein. The source of the embolus is commonly from the heart, as in atrial thrombus, and in valve vegetations in cases of atrial fibrillation, or from big arteries, as atheroma from carotid artery or aorta. The thrombus usually from the deep venous, from the big veins, causing in deep venous thrombosis. It might move in the circulation and cause pulmonary embolism, PE. In arteriosclerotic elderly patients, thrombosis may occur in the artery because of narrowing of the lumen, as one of the Virchow's triad. And when the embolus lodges at the bifurcation of the artery, means the circulation has stopped. A propagated thrombus, that the velocity has been very much reduced, the propagated thrombus will form behind the embolus. Now, embolism, by the word embolism, we mean a process by which a material embolizes, that is, it moves in the circulation from one part to another, and this material could be blood clot, fat, cholesterol deposits, gas, or tissues of malignancies, or foreign material. It moves distally to occlude smaller blood vessels at the site of the bifurcation. Now the symptoms and signs. The embolus usually causes acute limb ischemia or acute ischemia of the organ it lodges in, whether it's in the brain or in the limbs or anywhere. This is embolus, or in the lung. And the symptoms are usually pain, which is severe and continuous. It is ischemic pain. And the part will become limb, let us say limb, will become pulseless and pale and parasitic because of reduction of blood supply to the nerves, and later on it will become paralyzed because of cut off the blood supply of the nerves. And poikilothermic, that is hypothermia. The limb will become cold, and later on will be some discoloration, blackish discoloration of the skin of the limb, that is skin mottling. However, an embolus also can pass to the lung, and this has got other symptoms. On the other hand, in chronic limb ischemia, which is due to reduced velocity due to narrowing of the arteriosclerotic vessels, patients usually complain of intermittent pain called claudication, because of the reduction of the blood supply to the lower limbs. And later on, when the blood supply is severely reduced, patient will complain of rest pain. With the intermittent claudication, the patient goes for a distance. It is called claudication distance, and with time, the claudication distance might get shortened, and later on, the patient will develop breast pain, which is a critical stage. However, the thrombus that develops in a vein or in atherosclerotic artery, it causes pain, swelling. The limb will become warm because there is arterial blood supply, no venous return, or reduced blood supply, particularly in deep venous thrombosis. The limb will become warm because of the arterial blood supply, and it will become tender and distended and swollen because the arterial supply is going to the limb, while the venous drainage is closed by thrombosis, in deep venous thrombosis. Then later on, discoloration and mottling of the skin will occur, and some blisters will happen, and this is a very late stage of deep venous thrombosis in a lower limb. For investigations, usually for DVT, if we suspect deep venous thrombosis, we have to start anticoagulants like heparin or calaxane, and on suspicion, we have to start it to prevent pulmonary embolism. Any delay might cause pulmonary embolism, which is very serious and killing disease. Then, after starting anticoagulants, we request ultrasound, Doppler ultrasound, which is also called duplex scan. For acute limb ischemia, we request duplex scan, that is ultrasound of the lower limb, to see the blood flow in the arteries and veins, and it is obstructed usually in acute limb ischemia in the artery, usually high in the femoral artery, at the profunda femoris, usually. And also the radiologist will hear the differences of sounds between veins and arteries, and will know where is the site of obstruction. However, in chronic limb ischemia, because it is a chronic vascular disease involving all vessels, the patient should be thoroughly investigated. That is, we do an aortogram to see the part of obstructed, and we do an ECG, echocardiogram, also to see the status of the vessels of the heart. This is an angiogram, and it shows atheromatoous plaques here at the lower end of the aorta and in the common iliac left side, right side, while the left side is completely obstructed. Here, there are filling defects. These are also atheromatoous plaques obstructing the lower end of the aorta and the upper end of the both common iliac vessels. This is again an angiogram. It shows the lower end of the aorta, and it shows the common iliacs on both sides. Then the internal iliac and external iliac. And this is the internal iliac on the left side, but the external iliac is completely obstructed and occluded. And in this case, the vascular surgeon can take a bypass vascular graft from the patent area of the common iliac down to the popliteal vessel here, to the popliteal artery. And like in this is the vascular graft in blue. In this angiogram, it shows obstruction at the popliteal artery. The obstruction could be inside or in the wall or compression from outside the wall. Now, the complications of embolus and thrombus. Embolus can cause acute limb ischemia, and if it is not treated, there will be skin mottling and dry gangrene at the toes, and it will creep on to the ankle and to the leg. However, in chronic limb ischemia, when there is rest pain, it is a critical limb. If it is not treated, then distal ulceration occur and dry gangrene will occur as the toes, and then it will creep up the limb. However, in deep venous thrombosis, the thrombus might move and embolize to the lung and cause pulmonary embolism, which is very serious. Or if it was not treated early, deep venous thrombosis can form a painful blue inflamed leg and thigh, and it is called phlegmasia cerula dolens. Some blisters might appear, and the limb will be swollen and tender and bluish in color. However, if the swelling has increased to the degree that it obstructs the arteries, then to compress the arteries from without, then the limb will become painful and white. It is phlegmasia alba dolens. Now, complications of ischemia. We said a thrombus in deep venous thrombosis can cause a pulmonary embolus, and ischemia, if it occurs in an area of bulky muscles, there will be some muscle death, muscle autolysis with liberation of toxins and myoglobin, and the myoglobin will deposit in the kidneys, leading to uremia. The treatment usually for thrombus in deep venous thrombosis, we give an anticoagulants in the form of heparin intravenous or calaxane. And for an embolus, the patient should have emergency operation, that is embolectomy. And if there is a propagated thrombus, also thrombectomy to remove the thrombus, plus adding anticoagulants to prevent further thrombosis. And in chronic limb ischemia, the patient should be thoroughly studied, and then we should go for vascular reconstruction with a vascular graft. And in later stages, if there is ischemic black limb, then probably amputation. But all the time, one should have some antiplatelets or anticoagulants. Also, we have to control diabetes as the risk factors, hypertension, heart disease, hyperlipidemia, and the patient has to stop smoking. This is a chronic limb ischemia with black desiccated toes, and the limb is now changing. And this is acral ischemia due to disease in the blood supply. Probably this is a heavy smoker with Berger's disease because of blood vessel wall disease. Now, some questions to help the students study and discuss. The first question is, explain each of the classical 6 features of acute arterial occlusion in the distal part of the limb, that is before the skin mottling occurs, before the black desiccation gangrene occurs. These 6 features are pulselessness, pallor, pain, paresthesia, paralysis, and poikilothermia. Explain why each one of these occurs. And now, the complications of the delayed embolectomy. If a patient presented late, embolectomy itself is an emergency operation. But if the patient presented late after more than 6 hours, then there will be some skin mottling, there will be black changes in the skin color. And embolectomy is still indicated to salvage the limb, to save as much of the limb as possible. However, with the removal of the obstructing embolus, arterial flow will occur, leading to perfusion of the muscles which were already starting to autolyze and to break down. This will lead to the rush of blood, will lead to liberation of the toxins and myoglobin of the autolyzed muscles. It moves into venous return to the circulation, and it will cause hypotension with dark urine, that is myoglobin, which will deposit in the kidneys and cause acute renal injury. Therefore, close observations of this patient with adequate fluid resuscitation is mandatory, plus alkalinization of the urine to dissolve as much as possible of the myoglobin and to prevent renal failure. Now, an ask a question here. This is a known case of rheumatic heart disease with intermittent atrial fibrillation. She presented with continuous severe pain in her left foot for 3 days. Question 1, mention 3 abnormal pathologies seen in the photo. And see here. And mention the most likely cause for these changes and what is the structure being felt by the shown examining index and middle fingers. Now another question. This patient has undergone exploration at the sole of the right foot for removal of a deep-seated broken needle. The tourniquet was used to prevent bleeding during exploration of the foot. However, it was forgotten and it was not removed the whole night. This photo was taken in the morning, describes the changes in the limb and what is the most likely cause and what are the complications expected after releasing the tourniquet. Up to this point, I will stop to see you in the next lecture to continue our 6 lectures on wound and gangrene. And see you later. And leave you with great hopes and see you fresh and happy.